I know your title by heart. Let's go ahead and start with these questions. So the CDC says in areas with substantial and high transmission rates of COVID-19, people will be required to mask up indoors. This is regardless of vaccination status. Can you just explain to folks at home what substantial and high transmission means?
Yeah, so the CDC identifies two different criteria that go into defining transmission rates. So the first is the case rates, and they base it on the number of cases per 100,000 population over the previous week. So we have, for however many months, for a year and a half, we've reported our 7-day rolling average of cases. Right now we're at 18.6. You multiply that by 7, so we're at whatever that is, 126 or something cases in the county for the week. But to compare, say, St. Joseph County to Elkhart County, the standard is to base it on 100,000 population. And so when we exceed 50 cases per 100,000 population over the preceding week, that will move us into the substantial transmission category. Right now we're at 48.6, so we are a hair's breadth away. The other element is the percent positivity. So of all the tests done over the preceding week, what proportion of them were positive? That's been a metric that we've used also for a year and a half, but it's really subject to a lot of different variables. When Notre Dame was doing 12,000 surveillance tests a week, we expect that less than 0.5% of those will be positive. That's a very different group than if 2,000 people who are sick and have symptoms and go get tested. So the percent positivity by itself is not a great indicator, because you have to understand what all goes into that denominator. But the two factors that go into the CDC's definition of transmission rates are the case rates based on cases per 100,000 in the preceding week, and the percent positivity of tests in the preceding week.
So where do you think people should mask up, and when should they mask up, especially considering fully vaccinated people need to start in these high transmission areas? I also want to ask you about the logic behind that. What is the logic behind asking fully vaccinated people to mask up?
Yeah, so the logic behind it, I think, is twofold. One, unfortunately, with the change in mask guidance that was issued in May from the CDC, and then in most local jurisdictions followed it, it really was built on the honor system that, we recommended that anyone who's unvaccinated be masked. Less than half of our county right now is vaccinated, but when I go in the grocery store, I usually see one other person in a mask. I mean, very few people are masking. That means a lot of unvaccinated people have been going without masks here in the county over the last 2 months. And so that's contributed to the spread of disease here and all over the country. So even people who are vaccinated can still become sick with, even people who are vaccinated can still develop a COVID infection. The good news about the vaccination is that they're not likely to get very ill with it. They're not likely to be hospitalized or to die with COVID if they've been vaccinated, but they're still at risk of getting infected. The thing that's changed is that with the Delta variant, a greater proportion of people who are vaccinated may become infected with COVID, and they're more likely to transmit it because the viral loads are quite a bit higher. And so they're more likely to transmit. A fully vaccinated person is more likely to transmit if they're infected with the Delta variant than with any of the other strains of COVID that we've seen.
All right, now switching gears here back to schools, that was something else the CDC focused on in their new recommendations. Now all students and teachers have to wear masks. Do you expect that to apply here in local schools? Will kids have to mask up?
So we've recommended, that schools follow the CDC guidance, which until yesterday was anyone who's unvaccinated should be in a mask. For elementary school students, none of them are even eligible for the vaccine yet. So that would have meant all elementary school students should be in a mask. But the reality is only 22% of students in the 12 to 16 year age range in St. Joseph County have chosen to be fully vaccinated. That means the vast majority of classrooms in St. Joseph County in the coming academic year, the vast majority of students will be unvaccinated. And so, until yesterday, our recommendation was all those people should be in masks. The CDC, strong guidance from yesterday recommending universal masking regardless of vaccination status for, faculty, staff, and students in K through 12 schools. I know people don't want to hear it, but I do think it's the right recommendation because our priority should be in-person education. So to do in-person education safely for a population that's predominantly unvaccinated, the way to do that most safely is to be in masks.
All right. Now, many people think that this is a personal protective choice to vaccinate. Let me just start over here. Many people believe the choice to vaccinate is about personal protection, which of course it is, but how important is it to also control the spread of COVID-19?
Yeah, so Delta variant aside, for people who are fully vaccinated, as I said before, they're less likely to get seriously ill, be hospitalized, or to die if they're vaccinated. They also are less likely to transmit it than people who are unvaccinated. So while getting vaccinated has important outcomes for the person who's been vaccinated, it also protects other people because even if I were to become infected, I'm less likely to transmit it to you. The Delta variant changes that a little bit because it is more transmissible even in people who are fully vaccinated, but it's still much less transmissible than it would be in people who are unvaccinated. So the vaccine has benefits for the person who gets the vaccine, but it also has benefits for everyone that they are around.
Now, let's say I'm not vaccinated, and now everyone, including fully vaccinated people, have to wear a mask. What is the incentive for me to go and get the shot right now, considering that life hasn't really changed?
I think the most important factor that people should consider is that it dramatically reduces the risk of winding up in the hospital or dying from COVID. So at an individual level, those are the benefits that people can expect if they get the COVID vaccine. If everyone around us is wearing masks, the challenge is the Delta variant is so much more contagious than the prior strains. And so even with masks, it increases the risk that people are going to become infected. And it can, even the duration of exposure, there's some suggestion that the duration of exposure could be very brief and still transmit the Delta variant. And so it's an order of magnitude more contagious than what we've dealt with up till now. And that means for any one person who's infected, they're going to infect a lot more people. As a result, we will see not only more cases, but likely more hospitalizations and deaths. And that's particularly the case because our vaccination rate is so low.
Now, let's say I have already gotten the vaccine and now this new guidance from the CDC has come out that I have to wear a mask again. What would you say to those people? Was getting a shot a waste of time if the unvaccinated people have already started spreading the virus again?
Again, I don't think getting the shot is a waste of time because of those benefits you might get infected, but you're not going to wind up in the hospital and you're not going to die. The other thing is in small gatherings, you can invite fully vaccinated people into your home and be unmasked. It's really in the large public spaces. So, indoor concert venues, churches, movie theaters, any place where, a large group of people are gathered, particularly over, an extended period of time. If you're running in and out of the drugstore real quick, that's not the same risk as if you're going and sitting in a restaurant, sitting in a movie theater, or sitting in a concert.
Now, do you think that we'll see places start to require vaccines or require masks, let's say, to come and dine or to come and shop?
Yeah, I think it's an interesting question. I guess I hold out some hope that some of the national retailers will get on board and say, this is the best way to keep our employees and our customers safe. We're going to require people to wear masks. That helped us so much, across the county when national retailers got on board with that a year or so ago. So it'd be great, I think, for public health if the national retailers were to reinforce that expectation again now. I think at a local level, absent a national retailer, it is going to be left up to, each store owner is going to be left to their own devices. And that, just at a policy level, that gets really difficult to implement.
Yeah, definitely. Now, there is a lot of misinformation or rumors floating out there about the vaccine. And I think it's caused a lot of people to be hesitant to get the vaccine. I think one of the biggest ones we've been hearing is that the COVID-19 vaccine causes infertility. Is there any proof of that right now?
There's no data that I've seen and have reviewed commentary from fertility specialists and OBGYNs that, debunk this. So there's a theoretical basis for that concern, but none of it's been borne out by any of the data coming out of vaccine trials or in clinical use of the vaccine. So there's no evidence to support that the COVID vaccine causes infertility.
And for anyone out there still wondering, is the COVID-19 vaccine safe?
Yeah, I think the safety profile really has been very good for the COVID vaccine. And I'll admit, I was initially concerned just because it was developed much more quickly than any other vaccine that, I've seen in my professional lifetime. So I was a little bit skeptical on the front end, but the vaccine efficacy data is phenomenal. So we think about the normal flu shot, it's between 40 and 60% effective in any given year. COVID vaccines are 80, 90% effective. So the efficacy data is phenomenal, but then the safety profile also has shown really to be very good for, across the board with the COVID vaccines. That isn't to say there haven't been some adverse events reported, but on the whole, the safety profile really is very good for the COVID vaccines.
That's definitely promising.
And the benefits, again, in terms of, 99% of the people in the hospital or dying from COVID now are unvaccinated. So overwhelmingly, the serious adverse consequences of COVID right now are being seen in the population that's unvaccinated, and that's preventable. And that's the real tragedy. We have something that can prevent those significant illnesses and death.